So this has been bugging me for a while, I think. I could just tell you my thoughts about this and pose my questions, but I think it might be more interesting for you to follow along my thinking process with this, so you know where I'm coming from. So we have powder on the bridge scene right at the beginning. We see the scratches, we see it on the enforcer's face, we see them on the body's face here. But interestingly, we don't see them on her parents' eyes. Although that's not my question, I'm just pointing that out. So this raises the questions of, is this Powder's perspective and what she can see? Are the scratches actual things that she can see? Or are they an animated representation to convey her distress to the viewer? Is this potentially Vi's perspective, since Powder has her hand covering her eyes, but she's clearly peeking through? Seeing that the scratches seem to be consistent throughout scenes with Powder Jinx later on, then I'm going to go with the fact that this is Powder's perspective. So then that leads to the question of, if they are Powder's, then what is causing them? Again, is she actually seeing them, or is it for the purpose of showing us, the viewer, the distress that she is experiencing? So let's go with the fact that she is actually seeing them, as I think that leads to a more interesting discussion. Okay, so from my actual clinical experience, I haven't personally come across anyone who has had visual hallucinations at the actual time of the traumatic experience, like this close to it whilst it's happening. I've had loads where they've come on after, but not so much during the actual experience itself. And that's usually because during the experience itself, they've dissociated to some degree. So maybe, and I don't know about this, maybe during dissociation, a person could in fact hallucinate, but they don't know about it or they don't remember it because of the dissociation. So there's some methodological problems there in trying to capture people's experience. But in this, I'm guessing that Powder is experiencing and remembering this, like knowing she's having this experience. So if that's the case, then what does the literature tell us about experiencing hallucinations and trauma? So let's have a look. So there's this study by Geddes, I think it might be pronounced Geddes, Geddes, G'day, G'day, mate. So there's this study it's called Hallucinations in the Months After a Trauma, an investigation of the role of cognitive processing of a physical assault in the occurrence of hallucinatory experiences. So interestingly, this paper, when talking about understanding trauma and hallucinations, suggests there's a few ways that have been proposed of why trauma may lead to hallucinations. And that's discussed in this paragraph here, understanding trauma and hallucinations. I'll just very quickly give you a brief summary. It says there's a few ways that have been proposed. So intrusive images and flashback experiences, which is a hallmark symptom of PTSD, might mean that a minority of hallucinations may be simply better understood as re-experiencing. So essentially someone is misattributing a trauma-related memory as a current sensory experience. So their flashback and their re-experiencing symptoms of trauma are experienced as a hallucination from their perspective. They also say that dissociation has been considered one explanatory factor. Dissociation may be particularly relevant to hallucinations as it is characterized by a sense of disconnect from reality. However, the mechanism through which dissociation might promote hallucinations remains to be clarified. We also have exposure to trauma can cause negative changes in thoughts about the self, such as the sense of being permanently changed for the worse, resulting in previous conscious content being experienced as alien. Maladaptive cognitive responses to intrusive memories and thoughts, so such as trying to push thoughts away, trying to suppress them, or playing them over and over and over again in the form of rumination, they say may amplify the chances of hallucinatory experiences, as they not only increase the occurrence of intrusive cognitive events, but also increase their intensity. So things that you do in your mind to try and help or get rid of intrusive memories may actually end up increasing the likelihood of having a hallucinatory experience. But again, that would suggest that that would come after the trauma. This isn't during the trauma, which is the question that we're looking at. Interestingly, in this study, they do say how a trauma is processed may well impact on the likelihood of subsequent hallucination occurrence. And they also conclude that 18.9% of participants were rated as having at least minimal hallucinatory experiences, and 6.6 of the participants having hallucinatory experiences rated as mild or moderate. There was a statistically significant reduction in hallucinatory behavior between the baseline assessment and the 6-month follow-up, meaning that between the baseline assessment and when they reassessed 6 months later, there had been a reduced experience of hallucinations. They say that might be the case because in the direct aftermath of trauma, there's a raised likelihood of experiencing hallucinations. However, this increase in hallucinations at that point is only temporary and reduces over the following 6 months. And it's worth noting for reference that the sample size in the study is 106 participants, but their initial baseline, so the first time they spoke to them about their hallucinations, was between 4 and 6 weeks after their assault. So that's a bit too long for what I'm after to answer this question of hallucinating during the trauma, but this is interesting nonetheless. Okay, so there's this paper here from 2023 by Quid, or Quide, I'm not sure how you say that, and it's called Dissociation Trauma and the Experience of Visual Hallucinations in PTSD and Schizophrenia. So we have to be a little bit cautious of papers that have trauma and schizophrenia in the title, as it could be the case that it refers to people with schizophrenia and all the symptoms that come with that, who then experience a traumatic event and the impact that that has on their schizophrenia symptoms. So let's pick out some relevant parts here that might address our question. So we have a line here. Not surprisingly, people with PTSD, especially those reporting severe dissociative behaviors, also experience psychotic symptoms such as hallucinations. And we can see that most studies have focused on the experience of auditory and verbal hallucinations in PTSD, so not so much visual. And these hallucinations have been reported in 20 to 58% of veterans with combat-related PTSD and in 67% of people developing PTSD following civilian trauma. If we try to find something that's also got visual hallucinations, then we've got this paper by Robert Dudley in 2024, Hallucinations Across Sensory Domains in People with Post-Traumatic Stress Disorder. And we can see here that there were high levels of reported auditory, so nearly 90%, visual, nearly 60%, and tactile, 46% hallucinations. And actually, hallucinations in 2 or more modalities were the norm, and the number of hallucination modalities was moderately associated with a greater number of past traumas and PTSD symptoms. So again, this isn't looking at the time of the trauma, but it's looking at responses and experiences after the trauma. But this gives us an idea of how prevalent they are. Okay, so so we're back to a Queed study again. So they refer to a previous study by Wern and colleagues, and this bit is quite interesting. So the authors compared the phenomenology of visual hallucinations among 3 group of individuals. So again, this is visual hallucinations like Powder is experiencing. So they have a group with a diagnosis of schizophrenia, a group with a diagnosis of PTSD, who all have experienced dissociation, and a group with the diagnosis of both schizophrenia and PTSD. So there's no group difference in the severity of visual hallucinations experienced, with people more likely to report experiences of complex visual hallucinations rather than simple hallucinations. So all the hallucinations were reported of being roughly the same between the 3 groups. They were described as being real, irritating, distressing, difficult to ignore, and associated with what they call acting out and fears of losing one's mind. But what they did find is that the trauma-exposed groups, so the PTSD-only group and the schizophrenia and PTSD group, were likely to report trauma-related hallucinations, so hallucinations related in some way to the trauma they had experienced. And this is a really interesting bit down here as well that we've just had a look at. So we'll take a look at this because there's a bit of an explanation here. So when lower levels of dissociation are experienced, so that's less dissociation, heart rate reduces and the startle response is inhibited. Okay, so your heart rate actually gets lower and you have less of a kind of a jump response. And what this does, it makes the person freeze. So we've heard of fight, flight, freeze. This is the freeze response. They're saying that visual phenomena involved in flashbacks may form as the severity of peritraumatic dissociative behaviors increase. So the more you start to dissociate, the more you're likely to have what they call visual phenomena. You then get an increase of cortisol and adrenaline via what's called the HPA. And the sympathetic nervous system, respectively, will increase the heart rate and prepare the body in response to trauma exposure. So this is now going into fight or flight. So when fleeing is not an option, and as your dissociation starts to increase because you can't get away, individuals enter immobility, so the fright phase. So what they now call the fright phase. So this is a little bit different to the fight, flight, freeze response. But they have this thing called the fright phase. And that's when both the sympathetic and parasympathetic nervous systems are engaged. They then say that long-term and chronic repetition of this and the associated changes in stress and what's going on in the body may generate more global and complex disturbances in perception, leading to the formation of visual hallucinations. So essentially, this happening again and again and again is likely to lead to the formation of visual hallucinations. They then say, although the content and severity of the hallucinations are similar amongst people with PTSD compared with people with schizophrenia, the biological processes and nature of them are different. So it feels the same, it looks the same, but the reason behind it is different. This is all well and good. It is all really, really interesting, but it still doesn't feel like it answers my question of having hallucinations during the actual traumatic experience itself. This is speaking more to long-term experiences. Okay, so I've been searching for ages and I can't find anything that refers to visual hallucinations during the actual traumatic event. I'm guessing because it's just so hard to measure or to quantify after the fact. There's loads about hallucinations after the event, but that's not what I'm after. So if we are going with powder dissociating during that moment, let's take a look if there's anything that suggests that one can hallucinate during dissociation. Right, okay, so I've spent a little while looking at that. The literature seems to cover 3 areas. People with dissociative disorders that have hallucinations as an experience, which isn't what I'm looking for. People who have hallucinations due to another mental health problem, but then dissociate whilst having the hallucination. Again, not what I'm looking for. And people who dissociate as a protective measure to distressing hallucinations. None of those answer my question. I can find some anecdotal evidence on the likes of Reddit of people's experiences who report hallucinating during a traumatic experience, but we don't know anything more about their demographics or previous experiences. I say that as I don't want to take away from anyone's experience by saying I can't find much in the literature. I'm not saying this isn't a thing that happens. I'm saying I'm struggling to find in the literature an explanation of why it happens and how prevalent it is. So at this point, we're left with a bit of a maybe. Maybe these are trauma-related, in the moment hallucinations. Okay, let's think of some other considerations. Maybe the hallucinations aren't specifically trauma-driven, but actually she has an underlying mental health problem which is now surfacing due to this experience. So what other problems have hallucinations as a symptom? Well, we've got the schizophrenia spectrum disorders. We have other things like drug and alcohol use, Alzheimer's, Parkinson's, grief, medication side effects, analgesia effects, infections, tumours. And outside of the hallucinations on that bridge scene, we don't really see much in terms of symptoms. We kind of just see the hallucinations. If we look at Kantari's paper called A Review on Child Onset Schizophrenia, we can see that child onset schizophrenia is an onset prior to 13 years old. And they do point out that it's important to note that not every child who has psychotic symptoms has schizophrenia. Psychotic symptoms may be common among children with mood disorders, so we're having differential diagnosis here, or a history of trauma, as well as among those using illicit substances. It's also imperative to rule out medical causes of psychotic symptoms. Unlike adults, children have developmentally normal behaviors that can be misconstrued as psychotic, such as having an imaginary friend. So it's about understanding what they mean by their hallucinations, but given Powder's experience, we're kind of seeing them as hallucinations. And child onset schizophrenia, like schizophrenia in adults, involves a combination of both positive and negative symptoms. So this is when we start to differentiate between the different mental health problems that have hallucinations or psychosis as a symptom. So we have positive symptoms, which are the hallucinations, and delusions is another one. And we have negative symptoms, which it says are maybe harder to assess in children. Some children with schizophrenia present with cognitive deficits in the areas of memory and executive functioning. And it's common to see children with schizophrenia experiencing academic difficulties, isolation, social withdrawal, disruptive behaviors, and problems with speech and language. So one way to think about it is positive symptoms, meaning something is added, like an hallucination, where negative symptom is something that's taken away, like having a deficit in cognitive functioning or executive functioning. And we see that the onset of child onset schizophrenia is often insidious, and children frequently have pre-morbid social and occupational dysfunction prior to developing overt psychotic symptoms. If I'm assessing someone, either if I'm carrying out a mental health assessment as a nurse or as a therapist to provide some kind of trauma therapy, then something that I'm looking at is this idea called being prodromal. And it says here, child onset schizophrenia frequently presents with a prodrome phase prior to the onset of florid psychotic symptoms. So we're looking at those potentially schizophrenia negative symptoms at this point, because they tend to come first. They tend to come prior to the positive symptoms. And it says the prodrome phase is characterized by functional decline that affects multiple domains of daily living, including academics, social functioning, and self-care. I usually see it in my experience in kind of the self-care domain. A teenager will start kind of isolating themselves. They'll stop washing. They'll stop caring about their appearance. It will look like physical neglect. And it points out that associated comorbid psychiatric disorders may further complicate the differentiation of prodromal onset. So if you think you've got a child who looks like they're not washing themselves, they're not cleaning themselves, they're not feeding themselves, obviously parents will start hopefully helping them with some of that stuff that can mask that presentation. Or it could be something like depression, it could be grief. There's loads of things that could be causing that presentation that we need to be mindful of. At the same time, we need to be mindful that it's prodromal, and it could be some kind of early onset psychosis on the way. We then see that the prodromal phase is followed by the acute phase. So that's easier to identify because of the presentation of the positive psychotic symptoms and a continued decline in functioning. So that's when they'll start complaining of hallucinations or delusions, or you'll start to see that in their behavior. But again, this isn't really answering our question, because we don't know anything about powder. We don't know if there has been a prodromal phase prior to this, because we don't see that period of her life just from watching Arcane in a way. So we could be in a position where she has an underlying serious mental illness, and this traumatic experience has brought that on. But we also know it works the other way. Exposure to trauma can increase the risk of psychotic symptoms later on. So I've got a bit stuck at this point. I've spent probably a couple of hours hunting through the literature, and it's all the same picture as these few papers that I've just shown you. And remember, this is just focusing on that very first scene. I'm purposely not thinking about Jinx. I'm not thinking about the events after Powder throwing the monkey bomb. I'm just focusing purely on those symptoms during this bridge scene and what's causing them, keeping in mind what we know about the actual literature. So I don't know where to go from here. I'm a bit stuck. Am I missing something? Or maybe the answer just isn't there? Or maybe I'm just way overthinking this whole thing and I'm trying to fit an animated world into rules of the world that we live in, and it just doesn't fit. But I like this stuff though. It stretches me. It makes me a better clinician because it gets me involved in some of the latest research around this. And although it might not apply directly to Arcane, it's definitely going to apply directly to people that I actually see. And when I do training and things, I've I'm kind of up to date with things. I do enjoy this. It frustrates me a bit that I can't work it out. I'm probably a bit like Dr. House in some way, where I want to solve the puzzle. But let me know your thoughts. Let me know if I've just missed something, maybe. You know, when you get so focused on something, what's the phrase? You can't see the wood because of the trees, or something like that. Maybe I'm just missing something really obvious here. But if I am, let me know. I'm more than happy to go away and do some more reading and check this out. But that's where I'm at with this. So let me know what you think. I hope you enjoyed this. I don't know. I don't know what to call this. Me going down a rabbit hole, I think. But cool. All right, let's leave it there. I'll be interested to hear your thoughts.